HPP is really impressive results. We have informed development of hundreds of policies, strategies, action plans. We facilitated mobilization of millions of dollars for HIV/AIDS, family planning, reproductive health, and maternal health. We have trained thousands of people at different levels on policy, financing, governance, and advocacy.
HPP is focused on 4 key areas: policy, advocacy, finance, and governance. Previous projects and other policy projects tend to focus on the policy and advocacy piece, but I do think that the finance and governance is increasingly important as countries move toward domestic resource mobilization and also recognizing the role that good governance plays related to health and in support of family planning.
I'm impressed with all of the work that HPP has done. We've really focused as a project on empowering women and families to really take a look at improving the knowledge base, which gives people power to make change.
We've done a great job, I think, helping to build capacity of local stakeholders, and that really was our main mandate, to look at training individuals, look at training institutions, people within governments as well as people outside government.
And the conducive environment starts with the partners that we work with.
I think what people appreciate is that our work is participatory. We don't come in and tell them what the answer is. We work with them to identify what are the underlying issues, to come up with solutions, and then work with them to implement. Our field staff is all local hires, and I think that makes a real difference in understanding what the issues are and how feasible the solutions are.
I think what makes HPP Kenya unique is our capacity to be able to interface with the key players, especially the Minister of Health, and more important, to be responsive and flexible in our approach.
One of the strengths of our work in the field is really bringing all stakeholders together, from civil society organizations to government to clinicians and other healthcare workers and policymakers.
Otra cosa importante es por una parte con la sociedad civil y por otra parte con el gobierno, porque entonces podemos apoyar a la sociedad civil para que se capacite, para que fortalezca sus capacidades de abogacía, de diálogo político con tomadores de decisión de alto nivel.
We're starting to really see that while you can plan and try to address problems at a national level, it's really important to get down to local communities.
We have some allies emerging from those trainings. If people can be provided with information, I think they can be changing agents.
In each one of the countries where we work, we have local partners who are on the ground. Sometimes they're government people, sometimes they're civil society organizations, but each of them understands the reality of the countries that they work in.
Our local staff, they're highly respected, well connected, they know the healthcare system, they know all different players, they are trusted partners, they know the impact of different policies, what is good for the country. They are our main resources to make things happen.
I think there's an African proverb that sums it up nicely. If you want to go fast, go alone. But if you want to go far, go together. I think that encapsulates the approach that we take in building sustainability and local solutions to local issues.
If you are a medical doctor, you will be able to treat a couple hundred patients, throughout the life. But if you work in health policy, then you really affect the lives of millions of people.
It really is impressive and inspiring to be able to work with the policymaker in a country who's trying to be the change agent, or with the civil society groups who are really trying to fight for their rights, or the clinic and public health leaders who are trying to improve health outcomes for their patients. People always talk about the work that we're doing as if it can be depressing and overwhelming, and it sure can when you're dealing with HIV, and particularly in countries where it's a major public health threat. But I think what we've found is the type of people that we're working with in countries, from public health leaders to the policymakers or civil society groups, activists, they're really inspiring in the type of change they're trying to bring about. it really kind of helps bring that energy and passion to, I think, our team and the work that we bring.
One of the key areas that we've been working on has to do with financing and sustainability. The process is long and slow, but we're committed to making sure that women who want to use family planning have access to it.
And that's where I get my passion from, that I want to make a difference so that tomorrow that woman, that boy, that girl in the rural areas can have easy access to health and can go to a clinic and find a health worker who will receive them with dignity and provide the care they need.
USAID sets the stage, and partners that we work with in country, like the Health Policy Project, really make a difference in people's lives. And that's what's exciting to me.
Investing in policy pays off. Policy affects everything. Who is receiving services, who is providing services, how resources are allocated, how much money we are using for drugs, medicines. All of those decisions, policy is so key to it.
If you change health policy, you're making it sustainable. You have something to build on as you move forward to try to improve lives.
It is great to work at the individual level and do great things. But if you really want to see big change, big impact, that's the policy.